Hello, my name is Desiree Phipps. In this video, I will discuss a very rare disorder that occurs in humans called Fibrodysplasia Ossificans Progressiva, or for short, FOP. FOP, also commonly referred to as Stoneman disease, involves the gradual ossification of muscle tissue and connective tissue. Essentially, this disorder results in the formation of bone outside of one's original skeleton due to the tissue inside of the body turning into bone. The extra bone formation constrains mobility. FOP occurs in 1 in 2 million people. It has been misdiagnosed in almost every case. FOP is almost always the result of a de novo mutation, meaning it occurs spontaneously rather than the passing on from parent to child. This mutation occurs in a bone morphogenetic protein, the activin receptor A type 1 gene. The mutation causes the bone morphogenetic protein to overproduce. Flare-ups, or new bone growth, can be caused by traumas that include, but are not limited to, burns, bruises, and invasive surgical procedures. There are currently no effective methods of treatment for FOP. Right now, all doctors can do for patients with FOP is to manage their pain and inflammation through the use of anti-inflammatory drugs. Patients with FOP are encouraged to be cautious in their daily lives. Any bump or fall could result in a flare-up. Doctors resort to surgically removing lesions when there are no longer any better alternative options because surgery causes more complications in most cases. Researchers have classified FOP into 3 types: classic FOP, FOP+, which is classic FOP with the addition of unusual clinical features, and FOP variants, which includes variant FOP features. Other research being conducted includes the study of the progression of ossification, the frequent misdiagnosis of FOP, analysis of DNA sequences and skeletal formations, studies of gene formations in animals as compared to humans, potential treatment methods, and the evaluation and comparison of different reported cases of FOP around the world. As one would suspect, there are many unanswered questions regarding FOP. Here are just a few questions for which scientists are seeking answers. Why is FOP so rare? What is an effective method of treatment for FOP? In a molecular aspect, why are most patients with FOP born with abnormal big toes? Why does the occurrence and duration of new bone formation vary in each patient? How can we use research of new bone formation in patients with FOP to make new bone for people who have other bone diseases? One seeking a career relating to FOP has a few options. You could become a doctor with a specialty in bone disorders, a researcher in a lab, or a genetic counselor. One could also fundraise to help advance FOP research, or personally reach out to people whose lives have been affected by FOP. The research process can be very slow and frustrating at times. Identifying a drug that benefits patients more than harms them can take quite a while. Unfortunately, sometimes by the time the drug has been identified, it is too late for some patients to see any benefits from it. At the same time, it is very rewarding to reveal something that was previously unknown to the world and to know that you helped people suffering with FOP and their families. One of the most famous cases of FOP is of Harry Eastblack. Here, all 3 pictures show how Harry's extra bone formation has made his posture more rigid than that of a person who is not affected by FOP and therefore constraining his movement. Harry's condition progressed quite a bit. His skeleton is encased by a great amount of additional abnormal bone formation. This is an X-ray of the feet of a patient with FOP. Abnormally shaped big toes are common characteristics among nearly every person with FOP, and it occurs at birth, so this is a first clue for doctors that a person might have FOP. This concludes my video. Thank you for your time.